I'm Robin Pork and I'm the director of the Tinsley House Clinic.
What exactly is dyspraxia and can it be treated?
Okay. Historically, dyspraxia was called the clumsy child syndrome, and that probably sums it up, though it's not particularly politically correct these days to talk about clumsy children. What it boils down to is that many children have an inability to carry out or learn and carry out smoothly movements that they should be able to do, to be able to coordinate their movements, to time their movements. Now, in a great many cases, the problem lies in the brainstem. The thing is that on each side, that little triangle of pulsation sets the timing for movements on that individual side of the body. Right side for the right side, left side for the left side. Now imagine what would happen if the two sides were completely out of sync. Because when you try and do something like a button, the two hands have got to do different jobs, but within the same time frame. Now if they go out of sync, then you've got a real problem. That's why a lot of kids have problems with things like hand-eye coordination. They can't catch a ball, the timing's all wrong, their hand arrives too late, too soon, whatever. The other problem that we find with a great many children that have dyspraxia is that they also have very poor spatial awareness. If you think about it, if you were reaching for a cup of tea and you had to find your hand first, locate it, and then take your hand to the cup of tea, it would take forever. Which means that the area inside the brain here is under-functioning. It hasn't got the information it needs. And so you're going to end up having poor spatial awareness. And that's why literally you can fall over your own feet. You don't know where your feet are. You've moved them, that new movement hasn't been registered, you're going to have problems. You're not going to be aware of things around you. You're not going to be able to time your movements. In a nutshell, that's dyspraxia.
So the main symptoms and signs of dyspraxia, if that's the umbrella term we're going to use, or the international term DCD, are those fine motor problems. So at home, they have problems maybe getting dressed and cleaning their teeth, wiping your bottom, getting dressed, doing your buttons up, doing your shoelaces up. When you go down for breakfast, then using cutlery might be difficult, so your child might be a bit of a messy eater. Using a knife and fork, which is a two-handed activity, can be really quite difficult to do. Getting a spoon and not spilling when you're pouring a drink, that's quite a complex task. You've got to hold the jug and pour it into the cup. So that can be quite difficult. Sitting still and balancing on the chair. So even though you're sitting, it's still a balancing task. You need to balance and hold your cutlery. And then when you're going off to school, in school that can be really difficult because there's lots of tasks in school that require good coordination. So you've got to be able to carry your bag on your back and be able to unpack your bag and get your books out. You need to unzip the pencil case. You need to be able to write in class and keep up to speed with other children. And writing is a real problem, usually for young people who have dyspraxia. Learning to write, keeping the writing on the line, making sure that it's properly spaced, making the right shape so your letters are nice and consistent. Those are things that are really difficult. And then keeping up to speed as you get older, keeping up to speed with your peers. So when everybody else is copying down from the board, your child might actually find that that's much harder to do and get behind. And then sometimes get into trouble because of that, because they haven't copied down what they should off the board and then feel frustrated. So that's a secondary consequence, that feeling of frustration. And then at the end of the day, you've got to take and write down your homework. And so kids who've got writing problems, first of all, feel much more tired because they're going to have to work much harder than other children. And then when they get home, they may not have had written the right homework down. So they're going to feel pretty frustrated. And that other children will pick up and notice that a child with coordination difficulty looks different to them. And so it may be that they find it harder to make friends and keep friends. They get into trouble again because they can't do all their homework, but they don't know who to call. And so socially, we see that children with dyspraxia may well be more socially isolated and harder to keep friends, which is really hard because most children with dyspraxia will be average or above average intelligence. And so they will have the insight from the age of 6 or 7 often to realise they're different from their peers. Is your child having problems in more than one area, at home and at school? And if you think about coordination difficulties, well, there isn't much that affects you. It affects every part of your life, from getting up in the morning to going to bed at night. You need to be able to be coordinated to function. So if your child has got difficulties at home and at school, so it's pervasive, it's in more than one setting, and it's enduring, it's lasting over a period of time, then that means it's more likely they have that diagnosis.
Hi, I'm Dr. Sheldon Horowitz here at the National Center for Learning Disabilities. Welcome to our Ask the Expert series. We've had a number of parents write in and ask questions about dyspraxia. So what I'd like to do is just provide a little bit of an overview of what dyspraxia is and what kinds of treatments, what kinds of interventions we use to treat children with dyspraxia. First, let's say that dyspraxia is not in and of itself a subtype of learning disabilities, but many children with learning disabilities have dyspraxia or features of dyspraxia. What does dyspraxia mean? Dyspraxia is a motor skill difficulty. It's a motor skill disorder. And it's a very complex disorder. It isn't just one thing. Some children with dyspraxia have difficulties with handwriting. That's one of the things that we see most in children when they experience dyspraxic kinds of problems. We also see it in fine motor things like dressing and buttoning and snapping and zippering and using utensils, doing fine motor kinds of things. When we think about dyspraxic children, however, very often what we think of is kids who are bumping into things. They're clumsy. They have difficulty with balance. Children with dyspraxia very often have problems learning to ride a bicycle, or watch them in the playground trying to catch and throw and use a hula hoop and bounce a ball. These are things that are really difficult for children with dyspraxia. Watching them dance or teaching them rhythmic steps, also something that's very difficult for children with dyspraxia. These are kids who, when they're walking to their desk, because they don't negotiate space really well, they often have difficulties telling where things begin and end. They bump into things, so they're knocking things over, they're dropping things and bumping into other people's desks. And they'll also sometimes have difficulties with negotiating strength, so they may grab something really tight, or they may hold something a little bit too loose. These are some of the early signs and some of the ongoing signs of dyspraxia in school-age children. What's interesting also is dyspraxic kids, or kids with dyspraxia, also have difficulties with speech. Very often they have difficulties articulating the sounds of words. They don't move their tongues and they don't shape their mouths properly to form sounds. So they have some articulation disorders. They may also have difficulty modulating the volume of their speech. They may be a little too loud. They may be a little too soft. They may have difficulties adjusting their volume of speech in different settings. And they also may speak much too quickly or a little bit too slowly, or they may mix and match, and it may be difficult just in terms of how it is that their speech is perceived and how it's heard by other people. Part of dyspraxia is also that children will have difficulty with memory and focus. So a fair number of children with dyspraxia also look like have attentional issues, and some in fact do. And it looks like they have some memory issues, and they may have difficulties with memory skills more so than the non-disabled population. What's very typical of children with dyspraxia is that they have difficulty planning their motor skill activities, and they often have difficulty completing a task because they get lost in the process. It's so difficult for them to do some of the things that need to get done. They often don't complete the tasks that are demanded of them. So, what do? What are the kinds of treatments? Well, dyspraxia is not something that goes away, but the signs and symptoms of dyspraxia will sometimes lessen over time, and some of those signs actually dissipate as the person gets older and they develop strategies but also body strength. They have practice doing some of the things that were difficult early on in their lives. Very important for young children who show signs of dyspraxia is to be involved in speech-language therapy, to work on some of those articulation and volume and rate of speech issues. Occupational therapy is also very helpful, again, especially with young children and children in the early to middle grades. And physical therapy is also helpful for some children to help negotiate some of those balance and coordination issues that they'll demonstrate. Some of these things last a long time. Some of these things will go away with practice, but very much like is the case with some learning disabilities, the signs and symptoms of dyspraxia will not just by themselves go away.